when I was in grad school, I was a graduate teacher's assistant. So I did teach undergrad and I taught fundamentals of cell biology for neuroscience majors and microbiology lab. So I feel like with that, I'm really able to teach things in a way that makes it really easy to understand. And I make it so that it is kind of like I'm teaching them and I'm asking them, do you follow me? Does that make sense to you? And I really want everyone, meaning my clients, to understand what their payments are going to be, what happens if they get hospitalized, what happens if they just need to get blood work done. So what I'm kind of trying to coin as my motto is insurance is hard. Let me make it easier for you.
Welcome into the ROCC Pod, produced for the Royal Oak, Michigan Chamber of Commerce. I'm John Gay from Jagging Detroit Podcasts.
I'm Lisa Bibby, realtor with Century 21 Northland.
And today we have with us Christina DeGregory from Health Markets. Welcome to the show.
Hi, thank you so much for having me.
Before we get into the business stuff of what you do, we have to ask you, with the weather finally turning nice, about concerts, festivals, your big concert goer. What do you got going on this summer?
Yeah, so being in Michigan and being around Detroit, usually every year I'm going to the Movement, the electronic festival in Detroit. So Detroit's the birthplace of Techno. So I've been going to that every year for maybe 10 years. So that is coming up Memorial Day weekend. So I'm really excited about that. And then later on in end of June, I go to Electric Forest every year. So those are kind of like my two summer events. And then just throughout going out to summer patios at restaurants and bars and just hanging out on the weekends, listening to live music and stuff like that.
You know, it's so funny because before I moved to Michigan originally in 2011, I knew about the hip hop, I knew about the Motown, but I did not know about the EDM piece and how much it's rooted here until I found out about Movement and all this amazing stuff.
And I am so ready for spring. I want to sit outside on patios and eat yummy food. Christina, you studied biology before starting this career path. You have a master's in biological sciences. So how did you make the changeover?
Growing up, even in like elementary school, I love science. I love biology. So I kind of always had that in the back of my mind. I went to MSU and I got my degree in zoology. And then I went and got my master's in biological sciences. So I tried everything I thought I wanted to do. I love research. So my last goal was to work in a lab. And after graduating from Wayne State with my master's, to be honest, the job market was just not the best. And it was very unfortunate that that field was very stagnant based on my education level. I really wasn't wanting to get my PhD. So I kind of was like, let's do an abrupt career change, something that I have potential to grow in. I'm not stuck in one place. I can open my own storefront. So I kind of fell into this position with health insurance because I love talking to people. I love helping people. And this is just going to be a super rewarding career for me.
That's amazing. And, you know, the veterinary program at MSU, I mean, every vet in my vet's office, I feel like has a diploma from MSU. So you went from animals to biology for people and then stay with people, but on the health insurance side. That's fascinating. Yeah.
And I feel like I've been able to take everything that I've done during that time and now apply it to what I do now in terms of how is the medical field run? What is it that these people need? I've done so many things that now I feel like I have all the tools in my belt to talk to people and to help them and get the help that they need.
It's kind of how I felt when I transitioned from a radio career into a podcasting career, like using the transferable skill set, which is such a huge thing when you're moving careers.
Yes.
All right, so let's talk about what you do with Health Markets in terms of what types of insurance you offer and kind of walk us through like sort of the elevator pitch of what it is that you do.
Yeah, so I am an independent insurance broker with Health Markets. So Health Markets is a national broker agency. So I'm able to use the company as, you know, their brand name and use all the sales leaders and the marketing and everything that they have kind of as like a support system for me to build my career and build my own business. So everyone is independent. So our book of business, our clients, it's all our own and we run our business how we want, which I never thought I would be running my own business, which is really cool and exciting to have that under my belt knowing now. But yeah, so I do health insurance. We do marketplace insurance, so the Affordable Care Act or Obamacare. I'm able to help enroll clients into these ACA plans and then get them obviously their health insurance. So how the marketplace works is based on your annual household income, you may be eligible for a tax credit, which will then lower your monthly premium, give you better co-pays, anything like that, really.
Nice. So can you explain the difference between open enrollment and a special enrollment period?
Yeah, so every year open enrollment is between November 1st and January 15th. So this is when anyone's able to enroll into a marketplace plan. This is when you can change your plan. Needs change every year. Maybe you didn't really care for the carrier. Maybe you have more money to spend. Maybe you need to get a cheaper plan. So this is when everyone's able to enroll. Special enrollment period is anything outside of open enrollment. So any triggering event, such as loss of job, change of location. So if you move,
I would imagine divorce too, if you're on your special health care.
Change of marital status, if you have a baby, so that triggers it. So there are a lot of different events. And if you're never certain of it, always talk to me and I can see if there is a special enrollment period for you.
This stuff is so complicated and it overwhelms people so much. I think that it really is beneficial to have someone like you that can explain this in a way that people can grasp. What is probably the most common question you get from folks? Because this can be so overwhelming.
I think the most common thing is people not understanding what a deductible is, what an out-of-pocket max is. So when I was in grad school, I was a graduate teacher's assistant. So I did teach undergrad. And I taught fundamentals of cell biology for neuroscience majors and microbiology lab. So I feel like with that, I'm really able to teach things in a way that makes it really easy to understand. And I make it so that it is kind of like I'm teaching them and I'm asking them, do you follow me? Does that make sense to you? And I really want everyone, meaning my clients, to understand what their payments are going to be, what happens if they get hospitalized, what happens if they just need to get blood work done. So what I'm kind of trying to coin as my motto is insurance is hard. Let me make it easier for you. Because I really, really want every single one of my clients to understand it better and to be well educated so that there are no surprises if or when a bill comes.
Do you have an ideal client?
My ideal client is anyone who is not eligible for group coverage, so employer-based coverage. So if you're a 1099 employee, if you're a part-time employee or contingent that don't get those benefits. Also, people that tend to benefit the most from the ACA plans are lower income individuals. They will get the higher tax credit, which sometimes they're eligible for a $0 a month premium plan. So people who are on the cusp of not being eligible for Medicaid and then, lower income, I think the ACA really does help them the most.
Well, fantastic. We appreciate that you're helping so many people that don't know what to do and can't afford it. So what other products do you offer?
So any supplemental insurance, so obviously dental, vision, hearing. I also do indemnity plans. So I'm able to help enroll clients into accidental injury plans, critical illness plans, even hospital plans. So this puts cash in your pocket if any of these events happen. Medical debt is so high in the country just because, for one, it usually is disproportionate to lower income individuals, moderate income individuals, even, uninsured, racial and ethnic groups. They tend to have the highest proportion of medical debt, for one, because they think they can't afford it. And for two, they just don't have access and education to knowing how to get it. So I always like to offer and suggest these plans that can offset the out-of-pocket max or the deductible that maybe you have, you're paying $50 to $100 a month for your premium. But if you get hospitalized for, breaking a leg and you're in there for a few weeks, your out-of-pocket max is maybe $90 to $100, and that's still breaking the bank. And not many people have that to just throw away. So what these indemnity plans do is it kind of gives them that benefit check that they can use when that happens. So those are the other products that I offer now. And then I'm soon to be licensed in Medicare. So I'll start being able to help everyone enroll in Medicare when they're ready to retire.
That is a whole nother ball of wax in terms of complicated things. I've been helping my parents try to navigate that. And this is, it's a good thing, as you would say back in my hometown of Boston, that you're wicked smart, because this stuff is really hard to grasp. And I'm glad you're able to, number one, understand it for yourself, but then two, have that teaching background and that empathy that you have, that you're able to explain it in a way that most people can understand.
And I just love that you're an actual human being. I can't tell you how many times when you try to actually get insurance and they're like, yeah, we're going to connect you to here. And then it's like some AI chatbot, and then you're on a hold for forever. And then finally somebody answers and they don't know what you're talking about. Like, it's this whole circus that I love having someone like you that you can just pick up the phone, call directly, and you can walk them through the steps.
Yeah, and that's kind of how I approach it too. I always end with, here's my digital business card I'm sending you. Save my number in your phone so that if you ever have any questions or concerns, you call me directly. You're not calling into the 1-800 numbers anymore. You're not calling to a call center. You're calling me. I'm going to be your insurance agent moving forward, and I'm going to help you year after year.
I can tell that you're a person that likes connecting with people, and I know you're new to the Royal Oak Chamber. What's been your experience so far with the Chamber?
I love it so much. I'm so glad that I chose this one. I live in Warren, but my boyfriend lives in Royal Oak, so he's just like right around the block from the Chamber. And I'm always out in Royal Oak and Fernhill. I love this scene. I love the community. So I just came across this one and I thought, I think this is the one for me. And I'm so glad that I did, because every networking event, connecting with you, it's just been a really great opportunity for me.
Well, we love having you as a part of the Chamber. And now it is time for our Fishbowl question of the day, where we ask you a totally random question. John?
All right. Let's see here. Oh, this is perfect for you. Okay. If you could switch lives with any animal for a day, which animal would that be?
I love cats. So realistically, I would want to say a lion. But I've been to Africa and I studied animals in there, and I know how hard of a life it is for the female lions. So I would honestly say a bird, any little bird, maybe a bird of paradise, one of those, just because I think that is so freeing and they have plumage that is just beautiful. I would want to be a male bird because they have the better feathers.
Peacocks.
Yeah, they waste all of their energy on those feathers and they just walk around. I'd want to be
strutting.
Yes, strutting, trying to look good.
Is that the equivalent of the guy who buys the fancy sports car?
Yes, it is.
Lisa jumped right in there. She's like, yep.
Yes.
Nice. Well, Christina, it's been amazing to have you on. If our listeners want to get to know you and reach out, what are the best ways they can contact you?
Best way to reach me would be my direct line. So that number is 586-883-1955. Or you can inquire on my website. So that's going to be healthmarkets.com/C DeGregory. Also find me on socials, Instagram, Facebook, LinkedIn.
And we will link to all of those in our show notes. Thank you for joining us today and really kind of putting a face to this really, really complicated topic.
Yes, thank you. It was a pleasure having you on today. My name is Lisa Bibby. I'm a realtor with Century 21 Northland. I put the real back in realtor, and we want you to love where you live. Questions about buying or selling your home? Call my cell 248-981-3610. My website is soldbylisab.com, and you can find me on YouTube, Facebook, LinkedIn, and Instagram at Sold by Lisa B. Let's connect.
And I am John Gay from Jag in Detroit Podcast. If you have any questions at all about a podcast, starting a podcast, improving your podcast, I am your podcast guy. You can find me at jagindetroit.com, or you can follow me on social at jagindetroit. I want to thank you for checking out this edition of the ROCC Pod. It's produced for the Royal Oak, Michigan Chamber of Commerce. For more information about the Chamber and Chamber events, you can visit royaloakchamber.com. Thanks, everyone.